Dr. Rashawn Ray, a Rubenstein Fellow at the Brookings Institution, also an Associate Professor of Sociology at the University of Maryland. Dr. Ray, thank you so much for your time. Why is this happening?
Yes, thank you for having me on the show. So this is happening, and these disparities you just highlighted. In some of the analysis that I've done with my colleagues at Brookings for Michigan, for Wisconsin, for Louisiana, for Illinois, Blacks are about 75% more likely than their percentage of the state to be contracting coronavirus and dying from it. And this is happening not necessarily because Blacks have comorbidities. We actually have to realize that these comorbidities, these pre-existing conditions, is because of the structural conditions that place Black people in certain neighborhoods and white people in other neighborhoods. Predominantly Black neighborhoods are less likely to have healthy food options. They are less likely to have green spaces. They are less likely to have lighting and safety. They are less likely to have pharmacies so that they can actually get their prescriptions faster. And right now with COVID-19, such as in New York City, they are less likely to have testing places. They are less likely to have triage places, which means when the virus actually hits after that 4 or 5 day incubator period, they are further exposed to the virus. That leads to them having a higher likelihood of then dying from that virus.
It's interesting also because clearly the economic situation of many African Americans seems to play a part. According to the Economic Policy Institute, only 20% of Black workers reported being eligible to work from home, and that compares to about 30% of their white counterparts. In other words, they need to go to work because the bosses say, if you don't come, we're not going to pay you. Is that right?
That's exactly right. African Americans are more likely to be working what we call these new essential jobs. These jobs that now all of a sudden we are realizing that we cannot live without. Grocery store workers, sanitation workers, bus drivers, train drivers. African Americans represent about 20% of all of these jobs, despite only representing about 13% of the United States population. Part of what this means is they are leaving their neighborhoods, going to other neighborhoods, being exposed. Black people are also more likely to live in dense neighborhoods, meaning they come in contact with more people. Part of what's unfortunate, they are still working for a wage that simply should not exist in the United States. And what I mean by that is they are working literally for pennies on the dollar for the fact that they are putting their lives on the line. They need hazard pay. We also need a guaranteed income, and we need to increase the minimum wage so that people, when they are putting their lives on the line, they're putting their lives on the line for something in particular, not necessarily to just simply bag someone's groceries.
Tell me something, Doctor. Do you have any evidence of possibly African Americans not being treated in hospital? In many countries, they're only reporting the people who die in hospital, and they know that in time, when they come to add up the numbers of people who have died at home, there are going to be a greater number of deaths that are going to be confirmed. President Trump has said, has he not, that he's going to pay all hospitals to treat people who don't have insurance. So are African Americans actually getting to hospitals and getting the treatment they need? I totally understand what you're saying about their underlying conditions, that when they get the treatment, it's not necessarily going to save them because of those underlying conditions. But are they getting to hospital?
So there is some anecdotal evidence that Blacks are being more likely to be sent home from the virus. Part of what was sent out from the CDC, and it's gone out nationally and locally, is that when things get tough and they start to run out of beds and space, and there are some places in New York where this has happened, they're going to be more likely to turn away people with these pre-existing conditions. The people with these pre-existing conditions are more likely to be Black Americans. Part of the other part of this, of being turned away, is that if they have a longer distance to get there, and we have to encapsulate this in New York City, because they were trying to really enforce the quarantine and social isolation, they actually restricted the public transportation schedule. So it's not running at its normal speed. It's still running. But what that means is that they are less likely to have access to the public transportation that they rely on. Then they have to basically go an hour to get to a place. Once they get there, they are being more likely to be sent home if the hospital is using pre-existing conditions as a factor. And then, of course, we know from a long body of research that I've done, that Dr. Abigail Sewell at Emory has done, and other scholars, that the patient-physician relationship is very tenuous for Black Americans. They are more likely to be spoken to instead of listened to when they interact with healthcare providers. Part of what that means is that they are being given a treatment based on some pre-existing conditions not being listened to that might actually exacerbate the outcomes as it relates to COVID-19.
Donald Trump keeps saying that the African-American community loves him, that he's done great things in giving them or getting them more jobs. Is this going to cost him when it comes to November?
You know, I think that it's already cost him. When I hear Donald Trump make that statement, it's empirically not true. One of the things that I do research on is voting. And overwhelmingly, Black Americans have voted Democrat, and they haven't necessarily voted for Donald Trump. The one group that has voted for Donald Trump, and it's still slight, like 1 out of 6, these are more affluent Black men who kind of view some type of synergy with Donald Trump in a sense. But lower income Black Americans definitely don't see it that way. And part of this is the fact that the unemployment rate, part of what people have to understand in the US, the unemployment rate is about people who are actively seeking a job. So the low unemployment is one of those things where people have to be searching for a job. They had to have filed for paperwork. We know that there is a digital divide in some of these spaces. So you have a lot higher number of Black people who don't have jobs that they actually should have. The second thing is the quality of those jobs. What we're finding out now with these so-called new essential workers is that the quality and standards of their jobs, their pay, their benefits, are things that don't necessarily manifest to a better life. And we're seeing that under a Trump presidency that really needs to change moving forward.
Dr. Rashawn Ray, we really appreciate your time, sir. Thank you so much.